So in the second part of the PowerPoint, which will probably be split into 2 lectures, we are going to talk about the effects of ultrasound, thermal and non-thermal, and the application of ultrasound. So the learning objectives for this half, and these are the same ones from the module. You should know why a standing wave is dangerous, and we'll talk about that. You should be able to describe the thermal effects of ultrasound and their clinical applications. You should be able to describe the mechanical or non-thermal effects of ultrasound and their clinical applications. You should be able to describe the advantages to applying underwater ultrasound and the clinical decision-making process in deciding to use water as your ultrasound coupling agent. So when would you do that? I want you to be able to compare ultrasound parameter settings for acute, subacute, and recovery applications. You should briefly be able to summarize the application use of phonophoresis. Pretty simple. You should be able to, of course, state the contraindications and precautions for ultrasound and why ultrasound may be potentially harmful in those situations. And as you probably know by now, the book is really good at listing those. I want you to be able to discuss your decision-making for integrating soft tissue mobilization, ultrasound, and thermal agents in terms of the parameters that are available and the desired treatment effects, contraindications and precautions, and how the patient has responded previously. So this is really the decision-making process that is going to go into what you have to do for your practical exam. And so I want you to feel comfortable with that. So the effects of ultrasound, we have, for continuous ultrasound, you get thermal effects. That was one of the things that was first explored for therapeutic ultrasound, is the thermal effects. And of course, we just finished studying thermal agents, and so we know the reasons why we would want to affect tissue with the thermal effects. We want to be able to increase the metabolic rate, reduce or control pain, reduce or control muscle spasm. We want to alter nerve conduction velocity and increase circulation. And we want to be able to increase soft tissue extensibility. So you could see how a combination of ultrasound and soft tissue mobilization might be a really good combination. Because you use the thermal ultrasound to increase tissue extensibility, then you do your soft tissue mobilization, and then maybe you're going to be doing exercise and some other things and end up with cryotherapy. So you can incorporate those all into a treatment when you're using those thermal effects. So in general, when we're using a like a moist heat pack or something, we are heating broader, more superficial areas with those superficial heat techniques. With ultrasound, we're generally heating smaller, deeper areas. So we're trying to get right to the target tissue, the tendon or the ligament, or a smaller, more concentrated area. So you can think of ultrasound in its thermal guise as being a deep heating treatment. So of course, we talked about it in the last lecture. The ultrasound is absorbed more intensely, with the tissues that have more collagen in them. So how great is that? You have a tissue sprain and you want to increase the extensibility of that, and it's absorbed preferentially by those tissues. So ultrasound, for that reason, can be a really good approach. But it's particularly well suited for tendons, ligaments, joint capsules, and fascia, and it doesn't overheat the overlying fat. So towards the end of the quarter, we're going to talk about diathermy. We're not really going to practice it in lab, but diathermy does heat the overlying fat. The fat absorbs the energy from that. So ultrasound is a good one to use because everybody has some subcutaneous fat. So if we want to preferentially hit those collagen tissues without hitting fat, that's the way to do it. Pulsed ultrasound, or the non-thermal effects of ultrasound, we're going to talk about each one of these individually, but it has these small effects of cavitation, microstreaming, and acoustic streaming. It has the effect of increasing intracellular calcium, and we all know how important that is for nerve impulses and muscle contractions. And it promotes increased cell function, increased cell metabolism, and tissue healing. So there are really good reasons to use non-thermal ultrasound for a healing effect. So for thermal effects of ultrasound, we accelerate the metabolic rate, reduction or control of pain and muscle spasm, alteration of nerve conduction velocity, increased circulation, and increased soft tissue extensibility. Unique to ultrasound versus other heat modalities, it's localized, more localized, and it's deeper. Okay? So continuous ultrasound is well suited for tissue with the high absorption coefficients, such as tendon, ligament, joint capsule. All of those have relatively high collagen content, and they are going to absorb a lot of the ultrasound. So in this picture, this is from the book, of course, the ultrasound is being applied to the posterior knee in conjunction with an extension stretching force. So this person is lying prone. They've got a weight on their ankle to stretch them into knee extension, and the ultrasound is deep heating those high collagen tissues to increase tissue extensibility. So non-thermal effects, the non-thermal treatment of ultrasound alters cell membrane permeability, which accelerates tissue healing. So there are studies that show evidence of stimulating activities associated with tissue healing, including increased intracellular calcium, which stimulates protein genesis, increased skin and cell membrane permeability, increased macrophage responsiveness, and we all know the effects of macrophage in the inflammatory process, and an increased rate of protein synthesis by fibroblasts. So that's guiding our scar tissue formation. So the non-thermal effects are thought to be cavitation, acoustic streaming, and microstreaming. Most of the studies that show these effects use a 20% duty cycle. There is not a lot of research out there for a 50% duty cycle. So what are you going to use in your practical? You're going to use a 20% duty cycle probably, but maybe if you want a little bit of a heating effect, you'll go up to 50%. That's what a lot of people that I work with in the clinic say. They go, oh, well, in between non-thermal and thermal, I'll go with 50%. Even though it's not supported by the research, there you go. So cavitation and microstreaming. Cavitation is the formation, growth, and pulsation of gas bubbles in the ultrasound field. So there are two different kinds of cavitation, stable and unstable. So stable cavitation, the gas bubbles pulse, it creates microcurrents, and that is what is thought to affect the cell membrane permeability. That's that microstreaming. It's tiny little microcurrents around those gas bubbles. Unstable cavitation is where the gas bubbles grow and burst and release free radicals. It increases temperature and it increases the pressure in the area. That is not considered to be a therapeutic effect because it doesn't do anything. So the gas bubbles in the field expand and contract without bursting with the stable cavitation, and it's thought to increase cell membrane permeability and allow ion and molecule diffusion to aid in tissue repair and healing. So that's what we're trying to do. We're trying to increase cell permeability using those microcurrents. Unstable cavitation is a result of excessive expansion of the gas bubbles, and they implode, and it causes temperature increase. But unstable cavitation is proposed, it's thought that it doesn't occur at therapeutic ultrasound intensities. So you don't really get that with a therapeutic ultrasound application. So this is the, we talked about in the last lecture about the temperature distribution about the depth between 1 megahertz and 3 megahertz ultrasound. So 1 megahertz is going to go deeper because it's not absorbed by the tissues as much, and it doesn't have as great of a temperature increase in the tissue, the higher frequency ultrasound at the same intensity is going to have less depth of tissue but greater heating. So microstreaming and acoustic streaming, those are eddy currents that are around the little gas bubbles that are oscillating due to that cavitation, which is the expansion and contraction of the little gas bubbles. There's a steady circular flow of cellular fluids that's induced by ultrasound. That's the acoustic streaming. And it's thought to alter cellular activity by transporting material from and to various parts of the ultrasound field. So if we're trying to get nutrients into the cell, and that is aiding in transportation, that can help accelerate healing. So the clinical indications for ultrasound are soft tissue shortening, pain control, dermal ulcers. Ultrasound is used a lot in wound healing. Surgical skin incisions, except in certain cases, and we'll talk about that. Tendon and ligament injuries, fractures, carpal tunnel syndrome, and phonophoresis. So I'm going to wrap this section up, and then we'll start the next section reviewing the indications and go through the application of each one of those.